And if we have any means of putting up reminders to bring them up, we can do that quickly in the next few minutes. Maybe if you're talking, you're muted. Okay, you did that intentionally. Yeah. So welcome everyone
I
who
was just
joined.
responding to what you were saying.
Okay, yeah. Mm. Oh, hi, Dr. Chisom. I can see you. Uh, we've been relating, but I can see you. Good to have you here. Yeah, so let's remind everyone that we're live so that we can get it started. Um, so let me also do that. Elijah, I sent you a message. Okay. So at 11:05, we can see. Yeah. Um, okay. Hello, everyone. Good morning and Happy New Year to everyone who has joined. Um, Good to see you in the year 2025. Thank you for joining us again in EHA Clinics Academy webinar for January 2025. We're pleased to have another webinar topic we hope to be very, very interesting and educative, which will be centering on sleep disorders among adults and young people. Interestingly, you'll find that this is a very, very common reality. And with us today is a clinical psychologist and sleep therapist. Really interesting combination. So, psychologist Mary Blessing Ogbu. She is a dedicated clinical psychologist and certified sleep specialist at the Oliester Wellbeing and Recovery Center in Abuja, Nigeria. He has a passion for improving mental health and wellness, and Mary provides evidence based interventions to support clients in overcoming psychological changes, managing stress, and achieving restorative sleep. Her expertise spans a range of therapeutic modalities tailored to individual needs, including cognitive behavioral therapy, that's CBTI, and specialized treatments for sleep disorders. Mary is committed to empowering clients with tools to enhance their mental well-being and lead fulfilling lives. In her role at the Oliester, she integrates a holistic approach to recovery, focusing on mind-body connection to promote sustainable mental health outcomes. You're welcome, Mary. How are you today?
Thank you very much, everyone. I'm fine. Thank you, Obina.
Yeah, so good to have you. So, my dear guests, before I hand over fully to Mary, so the drill is simple. First, we'll be starting with a poll, just to get to know what you already know, and also to just get your hands a bit busy on your keypad. So it's going to be as interactive as possible and engaging also. And then secondly, as psychologist Mary begins her presentation, should there be questions and clarifications that arise, we would require that you just drop those questions in the chat box, and an opportunity will be given to entertain those questions. We would also maybe at some point also give opportunity for you to read out those questions for those who feel very comfortable with doing that. But we hope that this will be a very, very engaging session together. Right. So in the next few minutes, I will share the poll. Um, so Mary, help me know when they can see my screen. So please, once the poll is launched, everyone who is available, just engage the poll. Yeah, I think except for our audience on YouTube, everyone can engage this. So your time starts now. Yes, yes, I can see entries yet. Okay, yeah. Some people are beginning to respond. So you can attempt all three questions. Yeah. So we're waiting for everyone, please. Okay, so about 11 people have engaged the poll. Uh, okay, so in the next few seconds, I'll end the poll. Maybe 7 more seconds to go because I see most of the people we have in the call have already submitted a response. So the statistics is showing that about 85% have participated. Mary, I think we have a pass.
Yes, we do.
Yes. Yeah. So in fact, we have it at 100% already. So everyone who is present now has attempted the poll. Thank you, everyone. I think I love this class already. Mary, I'm sure we're going to have a very good time together. So
Yeah.
I'll publish the results so you can see.
Oh, okay.
Yeah. Can you see everything?
Yes, I can.
Okay.
I can't see the last quest. Okay, let me scroll down. Yeah, I can see.
Yeah.
Okay.
So yeah, okay, you already have a feel of what your class is like already, right?
Yes, I do.
Okay, so can I stop sharing now?
Yes, you can. Thank you.
All right, so I'll then proceed to um okay. I hope the poll is down now, right?
Yes, it is.
Okay, so I'll proceed to sharing my screen for your presentation proper. Please let me know when you can see it.
Yeah,
Is
I
it up?
can. now. Yeah, it's up.
Yeah, so over to you, Mary.
Okay, I think you need to move to the next slide. First slide. This is just an introduction of what we are going to discuss today. Okay. So thank you very much, Obina. Thank you everyone for joining in. We'll be discussing sleep disorders in adults and young people. And on my table of contents, I have introduction to sleep, common sleep disorders, signs and symptoms of sleep disorders, diagnosis of sleep disorders, treatment options, and the conclusion. Of course, after the conclusion, we're going to be having questions. Although we had a poll at the beginning, and it's quite interesting to know that a lot of us have a prior kind of, we have educated ourselves enough to know that sleep disorders exist. But the last question is what quite surprises me. Like, a whole lot feels like sleep disorders can be transmitted. But we're going to look at it to see if we have been able to, maybe we are going to be surprised at some information we're going to be getting today. I hope that I'm able to pass every information correctly today. So sit back, relax, be with me, and be ready with your questions at the end of it. Next slide, please. So, when we say what is sleep, we can't talk about sleep disorders without having an introduction to know what sleep is. A lot of people, when you ask them what sleep is, they just say, sleep is just rest now. Sleep is just to lie down and sleep. So what happens? What really happens? How many hours of sleep do you have? And all that. So we see here that sleep is a natural state of rest for the body and mind, characterized by reduced consciousness, decreased motor activity, and decreased responsiveness to stimuli from the environment. Yeah, sleep can also be said to be a fundamental human behavior that is essential for physical and mental health. It's very, very essential for our physical health, our mental health, and our overall health. Sleep is very, very important for it, and it is a fundamental human behavior. Every human should sleep. It's a behavior that it's something that we undergo every day of our lives. And so there are so many things that happen during sleep. The body undergoes several physiological changes that allows it to rest, recover from the day's activities. So we look at, when we talk about different things that the body undergoes, the changes that it undergoes, first of all, we are going to look at what the different stages of sleep. We have 4 different stages, which is the 3 first non-REM stage 1, non-REM stage 2, non-REM stage 3, and then before you get to the REM stage. For those of us who might be thinking, what is non-REM? Non-REM means non-rapid eye movement stage. So at the initial stage, you're just initiating sleep. Then the second stage, you're trying to be like kind of in between consciousness and like unconsciousness kind of. Then the third stage is where you're having your deep sleep, and you're not aware of whatever is going on in your environment. You're in a deep state of sleep. Everything is at rest at that point in time, except for your brain that works. Of course, it's going to work for the functions of other things that happens during sleep. Then when we have the rapid eye movement stage, that is when we have that's where dreaming takes place, and that's the end of the cycle of sleep. So we have a cycle of sleep that takes like let's say 90 minutes, and we're supposed to have this cycle several times in the night. So the amount of sleep requires varies from person to person, but most adults need between 7 to 9 hours. So because we're talking about adults and young people, I'm going to be breaking down the hours of sleep that are needed per age. So for young adults around the age of 18 to 25, the hours of sleep that are needed is around 7 to 9 hours. For adults around 26 to 64 years, we have also 7 to 9 hours for the first one. For adults around the age of 26 to 64, they can have about 7 to 8 hours. You know, as you get older, your sleep reduces. So for adults around above the age of 65, they get up to like 7 hours of sleep. Some of them might have reduced to like 6 hours. So some of them might also get up to 7 to 8 hours also, but it is dependent on the age. You might not be able to get up to 9 hours of sleep when you are older at the age of 65 and above. So next slide, please. So that being said, we're going to talk about the importance of sleep. So a lot of us feel that sleep is just to rest your head from the day's going about the day's activities. So you need to rest your body, rest your head to be able to function well, yes. But there are other importance of sleep, which is very, very vital. And so we see that sleep is vital, is good for memory consolidation. For people that do not have enough sleep, you find out that their brain are not able to properly store the memory of the previous day. Because during sleep, that's where we get to the brain gets to store whatever went on the previous day. And so when you have quality sleep, it helps to enhance the memory in the brain, helps you to remember whatever activity went on the previous day. And then we also have emotional stability. So we find out that most times sleep deprivation comes up with people having the next day being irritable, not being able to like feel themselves. Most of them are moody. Some even kind of feel some kind of anxiety as a result of not being able to have enough sleep during the day, during the night. Next slide, please. Okay, so I don't know why it got to this what causes sleep disorder, but okay. All right. So improved cognition. So getting enough sleep quality it's linked to improve cognitive function, especially for young adults. When you don't have enough sleep, you're not able to come up with good problem solving skills, and you're not able to even concentrate during the day. There's poor performance for young adults, young people who are still in school. There's usually poor performance in school. They kind of lose concentration because of the way they're feeling irritable during the day. They are moody and all that. So their cognitive function is affected also. For those adults that are working, also productivity and performance during the day is kind of reduced because, of course, their cognitive function is affected as a result of sleep deprivation. Also, we have physical health. So Sleep, we find out that sleep is important for our overall health, cells regeneration, and all that, even the organs included. But for those who are having sleep deprivation and come up with sleep problems, it is also find out that they may somehow be obese, or some are having heart problems also. Then we also have reduced risks of accidents. Of course, for those that uses the road most of the time, this is related to maybe the road transport workers, maybe those that operate machines and all that. When they do not have enough sleep, they may be at risk of coming up with accidents at work, accidents on the road, and all that. And this is all because of the deprivation of sleep. But when they're able to have enough sleep that is needed for them, these accidents can drastically be reduced. Next slide, please. Okay, so what causes sleep disorders? So we can't talk about causes of sleep disorders without talking about what causes sleep disorder. So, but again, we talk about what is sleep disorder. Some of us just feel like sleep disorder is maybe not being able to sleep, or the most popular ones, some people remember insomnia, which is very popular. I think I'm having insomnia and all that. But what is sleep disorder? So sleep disorders are conditions that affect the quality, amount, and timing of sleep you are able to get at night. So whatever disrupts your body's cycle, your body's sleep cycle, or also your daytime activity, most of the time, is content to be sleep disorder. So there are specific things that may cause these sleep disorders to happen, and it varies based on the type of sleep disorders you may have. So some common sleep disorders, before we discuss that, we look at the causes of it, which are a symptom of a medical condition like heart disease, pain or nerve condition, or maybe a symptom of a mental condition. Some people may come up with having depression, maybe anxiety, or some people might also be psychotic. It can also cause sleep disorder. Also, how well you sleep, which is also the quality of sleep you get. When you fall asleep, and if you can stay asleep, which is the timing, you may have slept late and you are unable to even stay asleep. That's maintaining sleep also. And then how much sleep and wakefulness you get, which is the quantity and the duration of sleep. Remember that we said that sleep disorders are conditions that affect your ability to get the rest your body needs and maintain wakefulness. So how well you sleep, the quantity of sleep you are able to even initiate the sleep, maintain the sleep, and also you are able to go about your activities during the day also is part of the things that affect your sleep. Also, genetic factors can affect your sleep too, can cause sleep disorders. Sorry. Genetic factors, maybe somebody in your family lineage has sleep problems. It may be passed on to the next person. You may be the one that might inherit that gene that will come up with having a sleep disorder. Next slide, please. Working the night shifts. This is related to some medical practitioners, maybe the nurses, maybe security, also like security personnel, or other people that work the night shift also. This may also cause like a disruption in your sleep cycle that can come up with causing sleep disorder. Then low levels of certain chemicals or minerals in the brain. Sometimes we have people having low levels of melatonin in the body, and we all know that, sorry, we don't all know. Some of us know that melatonin is the hormone that is responsible for our sleep and wake cycle. So when you come up with having low levels of these chemicals, it can also disrupt the amount of sleep you have, thereby you coming up with some sleep disorders. Next slide, please. So, common sleep disorders. So, before we discuss the common sleep disorders that we know, we can also talk about the categories of sleep disorders. So, there are different categories of sleep disorders, and it has been classified according to these categories based on the symptoms you come up with. You can have insomnia, which is one of the categories, because it is also, insomnia is one of the categories of sleep disorder. It is also a type of sleep disorder. It is a category because we don't just say insomnia. There are different types of insomnia. We have acute, we have also chronic insomnia also. We have sleep-related breathing disorders, which is one of the categories, and also central disorders of hypersomnolence, then parasomnias, which are also part of the categories of sleep disorders. So in discussing sleep disorders, we have so many other sleep disorders that we could discuss on. If we want to go on all of them, we may not finish this today. So there are a few of them which I listed out here and we're going to look at. So insomnia, which is one of it, like I said before, we have acute and then chronic insomnia. Before it is termed insomnia, you don't just wake up one night and you're not sleeping, and then the next night you're not sleeping, you just say, oh, I think I'm having insomnia. No. Before it is termed insomnia, you might have gone through some psychological assessments and make sure that you're not able to, the person is not able to initiate sleep or maintain sleep for a period of time, let's say for 2 weeks, for where we are talking about acute, it has to be for a period of at least 1 to 2 weeks that the person has not been able to initiate or maintain sleep. Then we say the patient is having acute insomnia. There are other insomnia, which is chronic and severe insomnia, which I will throw more light on if there is time. Then we have sleep apnea. Obstructive sleep apnea, which is OSA, is a condition in which the body stops breathing during sleep. We see people sometimes waking up, and those that experience obstructive sleep apnea, they wake up and they are struggling and gasping for air. They are struggling and gasping for air, and these can make them to maybe not want to go to sleep. This is also sometimes coming with some people having two like co-occurring sleep disorders, having insomnia and sleep apnea. Most of the time, we see patients coming with that, because when the assessment is being done, you see that, okay, this person is not just having insomnia, there's a reason why the person is not able to sleep, basically because they are having breathing problems, shortness of breath, they're waking up and gasping for air, and then going back to sleep becomes difficult because some of them may be afraid or scared that something might happen, something bad might happen to them when they go back to sleep. Next slide, please. Then we have restless leg syndrome. So for a restless leg syndrome, you see people coming up to have the urge to move their legs when they are at rest. This occurs especially during the night when it's time for them to sleep and have their rest. So you see them having the urge to move their legs during the night and not resting. And so this comes with so much anxiety and make. Next slide, please. So before
We lost you for a bit.
Okay, so before he gets to the next slide, I would go to discuss the next one, which is narcolepsy. So narcolepsy most of the time comes with you not being able to regulate when you feel asleep or how long you stay awake. You find out that people with narcolepsy kind of have what we call sleep attacks. Now you just see them just falling asleep wherever they are most of the time, and then after some time they wake up. So sometimes some people in a layman language they say you have sleeping sickness. So this is usually called in the medical term narcolepsy. They have sleep attacks. They cannot regulate the time they fall asleep or how long they can stay awake even during the night. But most of the time they have poor sleep at night most of the time. So you see them having these sleep attacks more during the day. Next slide, please. So we're going to be talking about the signs and symptoms of sleep disorder. So first, we see that one of the symptoms of having sleep disorder is trouble staying asleep through the night, or you wake up often in the middle of the night and can't fall back to sleep. Remember that I talked about insomnia, and I said when you're unable to initiate sleep and you're unable to also maintain the sleep, it means that you're coming up with having a sleep disorder. Second, we have snoring, gasping, or choking, which happens during the sleep. For people who are having sleep apnea, obstructive sleep apnea, they come up with this a lot, gasping or choking, which happens during the night also. Feeling like you need to move when you relax, which is related to having restless leg syndrome, and feeling like you can't move when you wake up. Sometimes some people have sleep attacks, sometimes they are awake, but they cannot move. So these are some of the symptoms of sleep disorders. Next slide. Okay. So there are others that we see during the day. You may be experiencing additional signs and symptoms caused by a lack of adequate sleep. So these additional signs and symptoms can be feeling very moody, some behavioral changes, being sleepy, feeling sleepy, not being able to concentrate at work, and not being able to even remember some things that you discussed about the previous day, and also having some difficulties completing deadlines at work also. This can also be some symptoms of sleep disorders. Next slide, please. So the diagnosis of sleep disorder. So before we dive into the diagnosis, we'll say that you cannot diagnose yourself of sleep disorder just like that until you have gone through some assessments. So, and it has to be from a specialist, someone who is a sleep specialist or a medical practitioner. And also, it has to also come up with you being able to go to contact some of the medical practitioners you know. And from all those signs and symptoms I have discussed about, feeling sleepy during the day, feeling irritable, moody, and all that. If you have all that, you may be coming up with some sleep disorders, and it's important that you see a specialist for that. So one of the the diagnosis of sleep disorder are sleep studies. So most times, what we use easily to diagnose sleep disorders are sleep studies. Sleep studies are tests used to diagnose and evaluate these sleep disorders. They measure your various bodily functions during the night and everything that happens. How many times you got up to use the restroom, if you were snoring during the night, if you woke up gasping for air, whatever happens during the night, it is used, sleep studies are used to kind of diagnose these sleep disorders, most of the time coming up with those that have sleep apnea or sleep paralysis, or also kind of insomnia most of the time. We also have multiple sleep latency tests. This most of the time is a daytime test that measures how quickly a person falls asleep. So this is for those that have narcolepsy, that find it very difficult to maintain how they fall to sleep, go to sleep, they fall to sleep or maybe maintain sleep during the day. You find them having like sleep attacks during the day. So the multiple sleep latency test is used most of the time to measure their sleep and also test how quickly they fall to asleep during the day. Next slide. Psychological evaluation. So this is a part in which you have to be asked like a lot of questions. There are assessments that you need to go through at this part. It consists of comprehensive questioning most of the time. Tracking is being done to know the behavioral pattern of that patient, if the patient is, how long the patient stays asleep, if the patient is able to initiate sleep or maintain sleep, if the patient also is able to practice his or her sleep hygiene. It's being done during psychological evaluation, so that the treatment, the right treatment to be used for that patient is being done. And during this psychological evaluation, we also evaluate if the patient may be having some other mental illness that are coming alongside with sleep disorders. Mind you, most of the sleep disorders most of the people having sleep disorders can come up with having anxiety or depression most of the time. Next slide. So, treatment of sleep disorder. So we have cognitive behavioral therapy for insomnia. This is one of the first treatments that we use most of the time for insomnia. We see a lot of people coming up with the common sleep problems, sleep disorders people have is insomnia. Why is that? It's because most of them do not practice a good sleep hygiene. They don't have a good sleep schedule, like a good sleep and wake time, and they sometimes use their bed for other things other than sleep, or for those who are married, for maybe sex. So they come up with having insomnia. And then sleep cognitive behavioral therapy for insomnia helps you to kind of check these behaviors that have affected this individual that made him to come up, him or her to come up with this sleep disorder, and then possibly correct them. Then we have CPAP. CPAP is usually used for those who have obstructed sleep apnea. Most of the time is positions in the airways to kind of open up the airways to help the individual sleep very well. If you find yourself having that, it is very important that your machine is always working. I have an experience one time when a patient called and needed to have his machine replaced because he cannot sleep without that machine. So it's important that if you find yourself having obstructive sleep apnea, it's important, and you have the CPAP machine, it's important that it's kept very safely, and then always checked for if it's working very well or not. Next one is the BiPAP or the BPAP. It may be considered to help patients tolerate. So that helps patients to tolerate the pressures in some cases, and oral appliances or a surgery may be done. So the surgery most times is done to put, so some patients do not feel comfortable with using the CPAP. So that's when they do this one. They do like a surgical operation to like fit in the machine to help the patient through their airways to help them breathe correctly. The next one. Okay, we also have medications like stimulants and SSRIs. So most times we see patients who have sleep disorders, sometimes they come up with, I have not been able to sleep for a long time. I've not been able to sleep for like 2 weeks, more than 2 weeks, and they come up with having the symptoms, being irritable, having anxiety. Some of them are so moody, they're not happy at all, they are very restless. You see them feeling really restless. For people like this, you don't just go and do a CBT, I start giving them sleep hygiene therapy, or maybe the relaxation techniques or all that. You start with medication alongside the CBTI treatment for that person. Then dealing with narcolepsy most times, it's really challenging. You have to make a lot of adjustments during the day to help you schedule with all the sleep attacks that you have and all that. Things that you, most of the time, counseling is really, really important for those persons to help them maybe get like support to manage their sleep attacks during the day. Next slide. So, in conclusion, we say that sleep is an unsung hero of our daily lives. It rejuvenates, restores, and refreshes us, as well as it helps us to be productive during the day. So it's important that we all give ourselves the gift of the needed time of sleep or needed hours of sleep that we have every day to help our health. So thank you very much. This is the time for me to have your questions, if there are any.
Thank you, Mary, for that very wonderful time. I love the way you ended. That sleep is an unsung hero of our daily life. Wow, what a way to put it. Yes. So, audience, I believe we had a very enriched time listening to Mary. So, Mary, before we take their questions, do you have any questions for the audience so that we can give them opportunity to interact with the thoughts you have shared? You were saying you were going to do something like that.
Let me hear their questions first,
Okay.
but I think there's one question already on the.
Yeah. What in your practice is the most common sleep problem you get to see and manage? That's the question we have.
Okay, the common sleep problems I have managed are insomnia. So this is because so most of the people that come up with co-occurring disorders, like people having mental health issues like depression and anxiety, they come up most of the time having insomnia. So they have this sleep deprivation because they are anxious. Recently have I recently have a patient who she does not have sleep problem. She has anxiety. Anxiety was the original problem. But she had come up with depression because she had come up with sleep problem, insomnia, because of the rate at which she becomes anxious with sleep. She feels like not sleeping may cause a serious harm to her and all that. So we have people who most of the time comes up with sleep problems because of the mental health problems they are having initially. And most of the mental health problems they have is insomnia. And also we have patients who come up with insomnia because of the medication they are taking. So medication, the side effect of the medication is that it causes insomnia. Some of them is not necessarily insomnia, it makes them to frequent the restroom, thereby reducing the time at which they maintain sleep. So when they wake up during the day, they find out that they are still feeling not well rested, feeling kind of moody and all that. So yeah, insomnia is one of the frequent or the most sleep problems that I've come across with and I've treated. Thank you.
Yeah, and I think the next question is something like that too. How can chronic insomnia be treated? Did you get
Okay,
that?
yes, I
Mhm.
got that. I can see it. So chronic insomnia is treated with medication and CBTI therapy. Therapy and medication, cognitive behavioral therapy for insomnia and medication. So when you have chronic insomnia, it means that you have not been able to either initiate sleep or maintain sleep for a period of 3 months and above, and which means that you need medication to be able to bring back your sleep clock to the normal you going to bed and having at least 7 hours of sleep for an adult, 7 or 9 hours of sleep for an adult. So you go together with medication and therapy. So it is medication and therapy because it is not expected that you take medication for sleep for a very long time. Therapy helps you to come up with behaviors that helps you to sleep, like looking at your sleep hygiene, looking at stimulus control, relaxation techniques, and also there also may be some other mental illnesses that may have caused the insomnia in the first place. So during therapy, we investigate for all these and also come up with behavioral patterns or behavioral changes that these patients would use to help them sleep better during the night, even when they have stopped using the medication. The next
Okay.
question says,
Yeah.
how do lifestyle factors like diet, exercise, or screen time influence my sleep? Okay, let's start with diet. So when you eat foods that are not very nutritious and it takes a longer time for it to digest, it affects your sleep, especially during the night. Because your body is supposed to be resting and then get to relaxation before it starts to initiate sleep. Now, not exercising also may affect your sleep. Now, we part of the sleep hygiene is that you take daily exercises. Now, daily exercises helps to release the hormones that are needed in the brain, and part of these hormones is melatonin, which is one of the hormones that is needed for initiating sleep. Now, exercise is not only these hormones, melatonin, you have serotonins and other hormones. It helps to make these hormones work better when needed. And then the screen time, when we say not having screen time, it's because the blue light that comes from your screen is most of the time does not help your brain to relax. So most of the time it is expected that you do relaxing activities towards the night, which part of it is at least going off your screen at least 2 hours before the time of sleep. Your screen does not help your brain to relax, and also melatonin to work fast. So the light does not help your brain to relax. You have to do relaxing activities. Affects your sleep, thereby making you not to be able to fall asleep when you are supposed to sleep. It inhibits the work of melatonin when it should work during the night.
Okay.
So the
Thank
next
you,
question
Mary.
says, does addiction to phone the next question says, does addiction to phone screen at night be a risk factor to insomnia? I just explained the blue light that comes that reflects on our faces during the night affects our sleep. It does not help our brain to relax. So during the night, you're supposed to be winding down. When it's close to your sleep time or your bedtime, you're supposed to be winding down your activities, part of which is having to go off your screen at least 2 hours before your sleep, so that your brain is relaxed and melatonin starts to work. So I hope that answers your question, Choma. Yeah.
Okay, so someone is also asking, is snoring a problem, a sleep problem?
Yeah, snoring is not necessarily a problem. You can snore normally during the night. It's what comes up with sometimes when we gain weight and all. But yeah, there are some slim people that also snore. But when it comes with having sleep obstruction, like coming to like gasping for air, then there is a problem. If it is normal snoring, then it's not a problem. It is only a problem when you share the room or a bed with someone and the person cannot be able to maintain sleep as a result of you snoring. But if it's not affecting the person sleeping or the person snoring and sleeping, then it is not really a problem.
Okay. Okay. So someone is also asking, sorry, let me get that right. Is it
It
what if like so apparently this person may be having sleep problems and he's saying medications hasn't worked for him. What should he?
okay. Can you hear me?
Yes, I can
Hello?
hear you.
Okay.
Yes, yeah.
So medication hasn't worked for him. What are the behaviors that he is carrying out while taking this medication? Has he been observing his sleep hygiene correctly, like having a sleep and wake time, even at weekends, having screen time, like I've explained before, exercising regularly, observing your stimulus control, like using your bed only for sleep and not for other things. And is his room, his bed, is it comfortable? We check when people are. Sleep hygiene is very, very important. It comes with the medication also because it helps to make you comfortable and have a good sleep. Again, sometimes medications can be changed. I don't know if you have used different medications before, if you have met the your doctor that has prescribed the medication and tried to make them know that the medication is not working. Yes, of course, sometimes you may be prescribed some medications and it's not working and can be changed. So if that has been done, your medications has been changed and it's still not working, we have to look at your behaviors. How are they towards, especially towards your bedtime? Is the temperature in your room conducive? Is there any noise coming into your room? Is your bedroom dark or there's a light coming in? All those things need to be checked.
Okay, I think there's one that in some of the things you have said, I guess you have touched it because someone was asking for some sleep hygiene tips.
Yeah,
I,
I just
you
said that.
mentioned them, yes.
I just mentioned that
Hmm.
now.
Hmm. Okay, there's this other one. Is snoring normal for a child of about 2 to 3 years old?
Uh, Most times it's not normal. Sometimes you may have to check with your physicians to see that the child is not having some problems with some obstructions with breathing. Yeah, so that needs to be checked. Also, you need also to check. So sometimes we ask questions like, is this a normal thing in your family? Do do children around this age like snore like this? So you need to ask yourself that question. Is it normal for your family? If not, then the child needs to be checked.
Okay, so I guess there are no more
Yeah, I saw
questions.
one question. Is sleep talking a sleep problem? Yes,
Okay.
it is a sleep problem. That is a sleep problem under parasomnia when people act their dream most of the time. So it is a sleep problem. It can lead from sleep talking to sleepwalking, or sometimes you find yourself even eating while you are sleeping. So it's a sleep problem, and if you're doing that, you need to see a medical practitioner, a specialist for that.
Okay, Mary. So I guess you have looked at okay, so I think you should look at this too. Someone is asking, can you explain sleep paralysis? I think that's a good one.
Okay, so sleep paralysis. First of all, the person asking me, does the person really? uh, believe in sleep paralysis. That's one thing.
Yes, it does for him to ask, or maybe he has heard it somewhere else. So he's seeking clarification.
Okay, most of the time, sleep paralysis happens when you feel the inability to move or speak while falling asleep or maybe waking up. So there are causes to this sleep paralysis. Um, uh, Most of the time is it happens when someone have like the REM. There's a sleep problem that comes with the REM sleep problem. So that is when you're about to wake, but you're not waking up, and you're having problem with coming fully awake most of the time. So some people tend it to be not medical, but it is. And explaining that, it's going to take much time for us. I think that person can contact me for that explanation, for further
Okay.
explanations. Yeah, because I need to talk about what causes it, who suffers sleep paralysis, and all that. So,
Okay, so just type into the person that they can reach us
yeah.
via our email. So, and then we'll see how to connect you to them. All right. So, maybe so. Except you have any final words, I think we have checked through all the questions. Somebody had initially asked what SSRI mean, and somebody else has also graciously responded to that
Okay.
request on the chat. That's selective serotonin reuptake inhibitor. So
Yeah.
this is a class of drugs mainly used for depression and anxiety. Okay. I guess you mentioned it in the presentation, and that's why the person is asking. Right. So,
Yeah.
do you have any final words or questions, or so that we round up?
Okay. My final words are not much. What I just have to say is that practice your sleep hygiene, which is having your screen time, exercising daily, uh, making sure that your bed is well made, the temperature in your room is conducive, and yeah, having some relaxation techniques before sleep and all. And also, if we are having if any of us are experiencing some of these sleep problems that we have spoken about, we can contact us here, the EHA services, and then would take care of that for you. So I think that's all. You can reach me through EHA at any time of the day. Yeah. So that's it.
Thank you very much, Psychologist Mary Ogbu, for this very great time you've had with us and some of the things you've shared with us, especially we look giving attention to our sleep hygiene. And I'm sure our audience, you've had a few things to learn and to take home and to improve upon. Of course, learning is never exhaustive. I'm sure even this webinar is not an exhaustive cover on sleep disorders among adults and young people. And of course, we can keep this conversation on and going. If you will just shoot a mail to us at academy@eha.ng, we can connect you to the relevant professionals to help sort out your issues. Thank you, um, Mary, a clinical psychologist and sleep therapist from the Oliesta place in Abuja. And so this brings us to the end of this webinar presentation. And of course, this has been recorded. So for those of us who rightly registered, either here on Zoom, or sorry, on YouTube, and you're registered, you'll be entitled to, you have access to the slides and to the recording after this webinar. Kindly help us respond to the feedback that will be sent to you. If you registered, you'll get a feedback form requesting for that. So once you respond to the feedback that comes to you, we'll be able to get the recording and the slides across to you. Once again, we want to say thank you, Mary, for your time. Thank you for you're muted. They didn't hear you.
Oh, okay.
Yeah.
I am on mute here.
Okay.
Like,
We can hear you now.
you know,
Mhm.
can you hear me? Okay, I just said thank you for having me. I hope that I've been able to cover up at least the basic of sleep disorders in adults and young people. Yeah, it was a good time.
All right. Yeah, it was for me too. So thank you, everyone. We'll be coming your way again. If you've registered, we can always reach you with our subsequent trainings. It's bye from us at EAD Clinics. Bye, Mary. Have a great day ahead.
Bye. Have a great day too.
Yeah.